So who's vulnerable to become addicted to drug? You? Me? Yes, all of us are. We all have different vulnerability quotients, if you will. It's a very complex formula. It's a combination of your genetic makeup. I can say with all honesty that everybody in this room has a different neurochemistry. So all of your brains are different. And all your genetic makeups are different. And we know that in addiction from lots of research that addiction has a very large hereditary component or genetic load, as we'd call it, roughly around 50%. That doesn't mean that if you have a predisposition to addiction that you are going to become addicted. You may never be exposed to drugs. On the other hand, you could have a very low genetic load and you could be in an environment where there are lots of drugs. And it's not clear that you actually wouldn't end up at some point having a problem with drugs. Does everybody who uses drugs become addicted? Absolutely not. The number is for some drugs is very, very low. For others, it's, again, a very individual thing. But no, most people who use drugs do not become addicted, do not have problems with it. But there are those that do. And those are the individuals that our research is here to serve. And those are the compelling stories that you tell in a lot of what you do. How much more? About 5 minutes, Sandra? So one thing that I want to tell you that about neuroscience, especially about our young people and vulnerability, is what drugs are people taking these days? We have well, here in California, of course, everybody's smoking pot. We know that. But cannabis, alcohol, tobacco, those are still the big three. But coming up on cannabis throughout the country and actually increasing, starting to overtake marijuana, is prescription drugs. We have a huge crisis in the country. And why is all of a sudden this a crisis? Well, I have a slide that shows that last year, in 2008, there were about 180 million prescriptions for opiate analgesics filled by pharmacies in the U.S. That's about 10 times the number that there were 15 years ago. So we've got a lot of medications. And if it's a medication, how could it be so bad? But yet we have a national survey that we do every year for high school students called the Monitoring the Future. And consistently since 2002, the first year we started asking the question to them about Vicodin and OxyContin, the numbers have been very consistent. I didn't believe them the first year. This is 50,000 students, national representative sample. I didn't believe the number the first year, so much as what I know and all my experience, because it said that 1 in 10 12th graders had taken Vicodin last year. I couldn't believe it. I didn't know 12th graders knew what Vicodin was. Well, 1 in 10. But 1 in 10 had actually taken it for non-medical purposes. And that number has stayed consistent since 2002. Every year we've asked the question. And 1 in 20 had taken OxyContin for non-medical purposes. So we have a major crisis on prescription drugs in the country for both our young people as well as for our adults.